Welcome to Life After Service, an information, education and support community. The Australian Department of Veterans Affairs, or DVA, provides access to healthcare through two pathways. The first is Non-Liability Health Care, or NLHC, which provides fast and free access to healthcare for a set of specified conditions. The second is Accepted Condition Healthcare Coverage, where you are covered for the cost of treatment for service-related conditions whose initial liability has been determined by the DVA. Let's look at these in more detail. Non-liability healthcare has been praised for providing fast and simple access to healthcare for all mental health conditions, cancer and pulmonary tuberculosis. There is no requirement to link any of the specified conditions to service, which makes processing and access to this entitlement more streamlined. NLHC is for treatment only and does not entitle you to any compensation or additional services, as the liability for the condition has not been determined. A diagnosis will not be required for a mental health application, but you may need to provide proof of identity and service. Getting NLHC for mental health is easy. You can apply yourself or use a representative who has been authorised to act on your behalf. You do this by emailing nlhc@dva.gov.au, calling the DVA General Inquiry Line on 1800 555 254, or completing the D9213 form and simply requesting approval. All current and former members of the Australian Defence Force with at least 1 day of permanent or continuous full-time service are eligible for treatment, as are non-CFTS reservists who served in disaster relief or border protection, or who were involved in a serious training incident. From the 1st of May 2018, mental health white cards are automatically being sent to members after separation without the need for any application. However, the eligibility for treatment of cancer and tuberculosis depends on the period, duration and nature of your service. To apply, you need to fill out a D9215 form. Moving on to Accepted Condition Healthcare Coverage. This is provided when you submit a claim for an injury or illness which can be linked to your service and which the Commonwealth has accepted liability for. If liability is accepted, you will be eligible for the cost of treatment and also compensation for pain and suffering or non-economic loss, as well as economic loss, which is assessed through a separate process. If initial liability is accepted, the DVA will issue a white card for the specific condition that has been accepted as service-related. You can then present the white card to your medical practitioner for treatment covered at the department's expense.